There are a few other surgeries that can actually reverse the effects of those types of very difficult diseases to manage, like the diabetes, like the high blood pressure, and heart disease, and those types of things. So from my perspective, that's one of the main reasons that I pursued bariatric surgeries, because this surgical intervention is a huge impact on patients' lives. Bariatric surgeon is a surgeon that's trained in general surgery, but that has additional fellowship training, or at least 1 year of additional training specializing in weight loss surgery. I attended medical school at the University of California in San Diego, and my general surgery training was in the University of Missouri in Columbia. In addition to that, I did 1 year of bariatric specialty training here in St. Louis. We perform all three most popular, most well-accepted and adapted weight loss surgeries, and those are the gastric bypass, which is considered to be the gold standard, the most commonly performed procedure for weight loss in the country, the sleeve gastrectomy, which is more of a newer procedure that's been around and evolving over the last 4 or 5 years, and then the adjustable gastric band, which has been around since the early part of 2000. The process of weight loss surgery that exist, at DePaul Weight-Loss Institute is actually a very approachable, very comfortable environment for them to thrive in terms of their goals of losing weight. It's not a confrontational environment. It's one in which patients are encouraged to pursue any means possible to lose weight, whether it's surgical or non-surgical. Tell me a little bit about your desire for weight loss surgery. It's very natural for patients to be nervous during their first consultation in considering weight loss surgery. A lot of patients that I encounter for the first time have been thinking about weight loss surgery for years, sometimes even 10 or 15 years, and they finally realize that they need to make a change. I know that when a patient comes in and finally makes a decision to undergo weight loss surgery, at least to pursue it, that it's been a very hard struggle for them to finally come to that conclusion that, hey, I can't do this on my own, that I need help. And we tell potential patients that are coming in that are interested in weight loss surgery, this is a lifestyle change. This is not a change that simply depends on the surgery itself, that this is a process that is going to require preoperative education. So education with regards to how their life's going to change, how their diet's going to change, things to anticipate, how to prepare themselves mentally. We have health educators and we have psychologists that meet with patients and make them understand that this is an overall lifestyle change and that surgery is part of it and is an important part of it, but it's not the only thing. You've done fantastic in terms of losing 15 pounds over the last few weeks. I really make an effort to try to be as encouraging to the patient. I also try to make as much of an effort as possible to see them and talk to their family members after surgery and encourage them to bring family members for post-operative visits following surgery as well, so that we're all on the same page and we all understand what we're dealing with and going through together. Why don't we go over a little bit about the anatomy in terms of what we changed. I like to see my patients the week after surgery, a month after surgery, 3 months after surgery, 6 months after surgery, and then every 6 months afterwards if possible. And I try to really focus on that. In the end, they're going to be very successful and much happier if they dedicate themselves to the program. This is not just a one-time surgical event, that this is something that's going to continue to require support, and that I am available for that support, that my staff is available to help them during that journey as well, and just make them understand that this is a lifelong commitment and that we're committed to them and we want them to be part of our program. We want them to understand that I am part of their ultimate journey as well. What I like to focus on is the health issues of the patient, but I don't kid myself. I understand that in the end, for a lot of patients, it's about how they look, what they feel their appearance is to others surrounding them, and I understand that. So even though I try to focus and emphasize to the patient that the reason why we're doing surgery or the reason why we're trying to manage their weight loss without surgery is for health-related reasons, but in the end I understand that appearance and actual just sheer amount of weight loss is very important to them. A lot of these patients come in feeling like they are alone, that they are the only ones that have struggled with weight, and it's very refreshing for them when they do come to our office to understand that there's a lot of people that are just like them, and a lot of these patients end up pursuing surgery and end up being extremely happy.